Abuse is using a substance in a manner that exceeds its intended medical, therapeutic use or beyond its socially acceptable use, basically getting drunk or high. Addiction is a brain disease exhibited by drug-seeking behavior, compulsions, cravings, disregard for harmful consequences, basically not being able to stop getting drunk or high. DSM-5 has 10 classes of drugs. Those are going to be alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedatives, stimulants, tobacco, other unknown substances. Here you can see most of those represented. U.S. has one of the highest rates of substance abuse and addiction in the world. Some stats from 2014, drug overdose was the leading cause of accidental death. 2.5 million Americans addicted to prescription opiates or heroin. 70% of Americans drink alcohol, with 12% of those. National drug overdose deaths from 99 to 2017. You can see those numbers skyrocketing in the past few years due to the opiate crisis. Every 15 minutes, a baby is born suffering from opioid withdrawal. In 2016, among people killed in driving accidents, 43% tested positive for drugs or alcohol. We all know that mental health disorders and substance abuse go hand in hand, with studies indicating that up to 50% of addicts have a co-occurring psychiatric disorder. Schizophrenia and depression have the highest occurrences of dual diagnosis, and this population is going to have a 10% higher risk of suicide than the general population. 7.7 million adults have co-occurring mental and substance use disorders in this country. Areas of the brain affected are going to be the brainstem, limbic system, and cerebral cortex. The frontal cortex is what lets us solve problems, plan, think, and make decisions. That's going to be impaired during addiction. The neurotransmitters involved in addiction are going to vary depending on the substance being abused. Some potential nursing diagnoses for substance abuse, some standout ones: risk for injury, risk for violence to self or others, ineffective health management. If you're in a hospital due to your drug and alcohol use, you're probably not taking very good care of yourself, and you're probably feeling pretty low, so hopelessness, spiritual distress, risk for suicide. The aim of treatment is self-responsibility, not compliance. So we want to abstain from drugs and alcohol, attend support groups, attend a relapse prevention program, identify the triggers that lead to relapse, establish a drug-free support network of friends, avoid those triggers, and demonstrate new skills in dealing with negative feelings. Here's some of the treatment options available. Of course, that's going to be dependent on their availability in the community and the patient's financial and insurance situation, as well as their willingness to stop using drugs and alcohol and seek treatment. Not everyone gets treatment. Here's some of the reasons why they don't get treatment.